Joining me now is health insurance expert Grant Cully, the CEO of Harbour Health Solutions. Grant, thank you so much for being with us.
Thank you, Kevin.
Grant, national politics is being dominated right now by the implementation of Obamacare, especially that new open enrollment for health insurance across the public exchange. That begins this week. What's going on with the individual mandate and these exchanges?
Well, the exchanges are opening tomorrow, Tuesday, October 1st. And a lot of individuals will be going to the exchange to compare what products are out there, what the pricing is, and what companies are actually participating in the exchange. It's going to be a mandate for all individuals to have health insurance by the year 2014, and if not, they could be penalized.
So to get access to one of these exchanges, how do you apply?
Well, there's several different ways of being able to apply. 5 different ways. You can go online and print out an application, fill that out yourself and send it in. You can actually fill out the application online. They do have toll-free numbers that have been set up by the federal government to help individuals go through their application. And they actually have navigators, which are facilitators that are helping individuals go through their application also. The 5th way is, of course, talking to your certified agent and having them give you good advice on what to do.
And you know a little something about that.
I know a little something about that, yes. We can actually help. We can actually guide people through their application process. We can show them the private exchange and the public exchange products, and we can give them advice on what to do.
So basically, people need to understand, depending on what they qualify for through the Affordable Care Act, there are these new federally subsidized insurance pools that, based on their income, I take it, they might be able to access?
Yes, that's right. If you are up to 400% of poverty level, for an individual that's about $44,000 a year, you could receive some federal assistance for your health insurance. Someone in the neighborhood of 150 up to 200% of poverty level is going to have most of their health insurance paid for by the federal government and be subsidized. They'll be able to pick the product that they want, and they'll be able to use that subsidy for that insurance premium.
So even if someone that already has insurance is happy with their plan, they could actually potentially get a reduced cost plan even though they already have insurance.
That is a possibility. They need to look into that. They need to look at what they currently have, compare that to what is available out there and all the different companies to see if they could actually do better than what they're doing now.
Yeah, I mean, the numbers I saw were that only about 25% of potential, people that have health insurance currently, about 65% of them, something like that, can actually access one of these pools. Again, even though they're not necessarily the population being targeted by the Affordable Care Act. Is that correct?
That is very correct, yes. The individuals, there's a lot of individuals that aren't aware of what's going on with the actual mandate and haven't been notified. But insurance companies are going to be available to help them. The brokers are able to help them, and the navigators.
Grant Cully, Harbour Health Solutions, thank you so much for coming on and answering my questions.
Thank you, Kevin.